Hi, this is Ashley with the APRN 782 Week 12 Reading the Evidence. This week's module, we were studying OCD and anxiety, and we were to review an article from the American Academy of Child and Adolescent Psychiatry on PANS and PANDAS, which is the pediatric autoimmune neuropsychiatric disorder associated with strep infection is PANDAS, and the pediatric acute onset neuropsychiatric syndrome is PANS. Um, Though it's rare, it really should be understood, and it should be a differential diagnosis that we as practitioners have an understanding of, and how infection can activate the immune system and cause these changes in mood and behavior that can lead to food aversions and also OCD symptomatology. Um, so this article from the American Academy of Child and Adolescent Psychiatry was really interesting, and it kind of led me to looking further into this topic. And I found an article by Wald et al. 2023, estimating the incidence of PANS and PANDAS in three different primary care populations. And so to determine the incidence of these disorders, they performed a retrospective review, and they looked at the years of 2017 to 2019 at three different academic medical centers. They identified the population of children that were receiving Well Child at each of the institutions, and they looked at the potential cases of PANS and PANDAS for children ages 3 to 12. And they had five other new diagnoses that led them down, whether this was PANS or PANDAS. It could be ARFID, other specific eating disorders, separation anxiety of childhood, obsessive compulsive disorder, and other immune mechanism reactions. The population consisted of 95,498 individuals. Of those, they found 357 potential cases for PANS and PANDAS, and 13 of the cases were actually found to meet the criteria, which they really specifically laid out in this study. Um, so it showed basically the incidence of PANDAS and PANS was 1 in 11,765 children between ages 3 to 12. And there was a little variation with different geographic areas. But the conclusion showed that PANDAS and PANS is a very rare disorder. But it is important for us to understand as practitioners, the Johns Hopkins Nursing Evidence-Based Practice Model. Again, this is a retrospective cohort study. I rated this as a level 3 non-experimental, but it was high quality. There was a large sample size, three different sites that it looked at. It gave really clear definitions of exactly what PANS was and PANDAS, and how to differentiate that in the study. And it also added further support and research for especially primary care providers that are diagnosing this potentially, and some improved practice recommendations. My second article was kind of along the lines of my capstone of looking at nurse-led interventions. It was Wong et al. 2023, and it was looking at the synergistic effect of a proactive nurse phone call in helping them use an older population use an app, and it was a three-arm randomized control study. So it used the case management portion of the nursing care and looked at the effectiveness of that, led by a nurse, and how they could sustain the use of this mobile health application among older adults with chronic conditions. And again, this was a three-arm randomized control trial. It had 221 participants. So they had three different groups: the group that was using the app, those receiving the app that had nurse support, and then there was a control group. And it was really clear that the interactivity with the app was improved with the nurse supported group at 37.8%, compared to 18.3% from those that didn't have that nurse supporting them using it. Um, Also, it showed that those that continued to use the app had improved depression levels and self-sufficiency, and it showed positive outcomes for technology with a nurse-led support. So that was just really good information, I think, to remind us of the role of the nurse in supporting patients with chronic conditions. Obviously, more research is needed on the longevity of the use of apps, especially in the older population. But according to the Johns Hopkins Nursing Evidence-Based Practice, this was a three-arm randomized control trial at level 1, high quality research. It was gold standard research. So For spiritual integration, I'm going to combine that for both of my research articles this time. I was thinking of First Thessalonians 5:23. May God himself, the God of peace, sanctify you through and through, and may your whole spirit, soul, and body be kept blameless at the coming of our Lord Jesus Christ. And this is reminding us of holistic care and how it's encompassed really in both of these studies, ensuring that we as providers are remembering the importance of holistic care when we're giving differential diagnoses, that we're not dismissing the whole person, the body, mind, and the spirit. And that was really seen in the first article. And then the second article, remembering also holistic care. As we use newer technology, we can gather important data and important information to that individual that's happening in their life week to week. And as we care for patients, we can make and improve our treatment plans and make them more individualized for that person. And as a nurse, just being a support for the patient and family and helping them to utilize things that could really improve their care. So thank you for taking the time to listen to this, and I will post my articles or my references. Thank you.